building. So this is what is known as acute scrotal pain. So acute scrotal pain. So you could actually define the terminologies. When you say something is acute, it's starting all of a sudden. Scrotal is in the scrotum. Okay, pain is literal pain. Do you understand? So acute scrotal pain. So acute scrotal pain could occur in children and adults. So this is now classified under urological emergencies, right? So rapid diagnosis and management is very important because you don't want to have complications in this, because testicular tissues could actually even die off. Okay, so common causes of acute scrotal pain include things like testicular torsion. This one, the testis is twisting on itself. All right, so there's twisting of the spermatic cord, and this is literally cutting off the blood supply. Okay, then there's torsion of the testicular appendage. This one, there's twisting of the small vestigial remnant. Okay, then sometimes causes of acute scrotal pain is epididymitis, where there's inflammation of the epididymis. That's like a cap on your testis. Then sometimes there's orchitis, where there's inflammation of the testis itself. Okay, so sometimes it's trauma, where you're having direct trauma due to accidents, road traffic accidents and all of that. Then sometimes it's incarcerated inguinal hernia. So this is a herniated bowel that is trapped in the scrotum. Like part of your bowel goes into the scrotum. Okay, so clinical features is there's sudden pain, high riding testes, absent cremasteric reflex. There's pain with fever, with this inflammation due to infection. Okay, dysuria, where you want to use yourself, is painful. Gradual onset. Then trauma is probably there's a history of injuries. There's a history of swelling, there's a history of bruising. Then there's scrotal swelling. That's basically if you are dealing with hernia. Okay, so if you have some tissues from the stomach actually going into the scrotum, okay, it could actually become bigger than how it was. So diagnosis is clinical examination. You are seeing all those signs and symptoms. You are actually looking at the patient and you are seeing issues. You can also do Doppler ultrasound just to also access blood flow to the testes. Urinalysis if infection is involved, so that you can pick up the microorganism that is causing those issues. So emergency management is immediate surgical exploration and detorsion. If it is testicular torsion, they have to unwind the spermatic cord. The occipitopexy, okay, then appendix torsion, you have to support care, then treat pain like using analgesics. If it is infections from bacteria, you can use things like antibiotics, then also analgesics. Then trauma, you have to surgically repair if there's any damage to any tissues.